All right, guys, today I'm here with Kaylin Wisniewski, and we're going to talk a little bit about her background, her interest in CrossFit, her interest in pelvic health, and kind of some of the things she's doing at our Hudson office there at CrossFit Cadre. So, Kaylin, welcome.
Thank you.
So you're just joining the team, which we're super excited about. Your background is very interesting. You've done some travel therapy, you've done some pelvic floor health, you've done some dry needling. So you just want to, let's start by just kind of tell us a little bit about yourself, kind of your background, how you got into PT, those kinds of things.
Yeah. So I was interested in physical therapy pretty much straight from high school and kind of stayed that route. I went to Kent State for undergrad and Ohio University for grad school. Right after grad school, I did travel PT for 3-ish years, I guess, kind of through the pandemic, three or
And for
four
people
years.
that don't know, what is travel PT?
Yes, good question. It's very much like travel nursing. So you have a rotation in a different state, a different city, a different setting for a certain amount of time, generally 8 to 12 weeks.
What made you do
So,
that?
hmm?
Why'd you do that? Why'd you decide to go travel?
So I, out of school, really liked all different types of PT. I really enjoyed the hospital setting. I really enjoyed the outpatient setting. And my husband is actually also a physical therapist, and he was 2 years behind me in school. So we set it up so that I would be around for his clinicals. So he did a clinical out in Washington, and I got a travel rotation there. And then back to Ohio for another rotation for his classes, and then out to Oregon for another rotation. So just kind of followed him for that.
Wow, he was all over the place.
Yeah, and we both love to travel. We've been all around the states. We're now that the pandemic is settled down, just getting out of the country. So yeah, travel is a big part of our life.
You just got back from a big trip. What was that?
Yes, so we went to Europe. We did a 10-day hike in the Alps. So backpacked and stayed at different hostels every night, and then went to Rome for 3 days after that.
Wow. What's staying in a hostel like?
Oh, it's pretty different than like a hotel. So you're in bunk rooms with a bunch of random people who you've never met unless you've met them along the trail. So depending on who is snoring loudly, you either get good sleep or bad sleep. But it was super cool. We got to meet some awesome people from all around the world, try some really great food at all the hostels because it was pretty authentic to the area. So it was super neat, a cool experience.
Were,
And
were
we
mo-
go ahead.
I was gonna say, were most of the people also hiking? Like, was that the bulk of who was there?
Yep.
Yeah.
So pretty much everyone that we met at the hostels were doing the hike with us. So it's called the Tour du Mont Blanc, and Mont Blanc is a big mountain out there. So you're basically going around the base of the mountain, kind of to these mountain towns and in these just small town areas. So it was really cool.
What was your total distance? Like, how far did you guys go?
It was about 100 miles
Dang,
total. So, and it took us 10 days. So like an average of like 10-ish miles a day.
that's hiking.
Yeah. And actually in 2022, we hiked the whole Appalachian Trail. So
Oh
we
wow,
are definitely big hikers.
you're into it.
Yeah.
How long is the Appalachian Trail? That's
So it's 2,193 miles, and that took us 5 months.
you did the whole thing.
The whole thing from March to August.
That's insane.
Yeah, it was super cool. So we were actually living out in California before that. So I had gotten a travel rotation out there. And we had positions for about a year and a half there. Moved back in February of 22, started the hike in March, finished in August, and then got jobs in October.
That's crazy. Is that
Yeah,
something you've like always wanted to do, or was it just like a spur of the moment, let's go do this?
we had actually been planning it for about 3 years. So before I met my husband, was not on my radar at all. He is the big hiker, and he kind of got me into it. So we were on a trip in Texas, and we were hiking around, and he brought it up, and I said, well, maybe let's look into it. Why not? And I've bit my tongue since then. But it was an incredible experience.
Yeah, that's a no joke commitment there.
Yeah, it was awesome.
All right, so that's go crazy. So you get done with this crazy hike, you start working. Um, how do you end up back in Ohio? Like what brings you back home?
Good question. So we have family here. So both my husband and I went to Stowe schools,
Okay.
and both of our families live in Stowe. So those next steps, settle down, buy a house, get a dog, all those things. And living in a lot of different areas, um, we found out how affordable Ohio is compared to, say, the West Coast.
Yeah.
So yeah, and our family is here, and we've come to appreciate it a lot more than I did when I was younger. I just wanted to get out of Ohio when I was young. But now, just the access to the trails, the just all of the things that we have in Ohio, it's really nice. And I like the change of seasons. You don't get that as much in some other places.
Yeah. I always say I love Ohio except for February. You can cut
That's
that month.
very true.
You can
And
cut
it's
that
a leap
month
year
out.
this year, so we get an extra day of
Yeah.
it.
Yeah. If we get rid of that month, I think it'd be perfect.
Yep, that's very true.
By then
Uh,
I've had enough of the snow and the ice and all
yeah.
lots of things to do here otherwise. And
Yeah,
having the
yeah.
family around is just so key.
Yes, it's huge.
Very cool.
Yeah.
So you got a couple different things going. You got an online um, pelvic health kind of company. What triggered that? How'd you get started with that? Tell us
So,
about it too.
hmm,
Tell us more about it too.
yeah. So when I was in California, I got pretty interested in pelvic health. I started doing some research into it. It started with listening to a podcast that had a pelvic floor PT on there. And it just kind of like a clicking moment, like, oh my gosh, I would love to do this. I took two classes while I was out there because they don't teach you pelvic floor PT when you're in PT school. It's something you have to take more education for.
True of
So
most. Like PT school is very much a generalist degree, just for people listening. Like it's not like you come out knowing how to do a little bit of a lot of things, but you're not a specialist in any one area, I would say.
yes, definitely. So I took two courses while I was out there and learned a lot about pelvic floor. So when we got done with the trail, I knew that I wanted to get a job that focused on pelvic floor, pelvic health. And currently I do work with mostly pelvic health um, folks right now. And it's super great. I love it. You can really make a huge difference in people's lives with that area. A lot of people who come to me have been suffering with pain, leaking, prolapse symptoms, diastasis for years, and they've been discounted by different physicians, doctors, people, just because a lot of people don't understand the pelvic floor very well. So it's great that pelvic floor therapy is actually getting some more traction out there. A lot of my patients are coming to me saying, I asked my doctor for pelvic floor therapy and they were kind of confused about it. So it's been awesome that more and more people are coming straight from just hearing about it on social media, hearing about from X, Y, or Z, and then requesting it from their doctor.
Yeah. That's not my niche, but you see more and more of it on social media now. Like I feel
Yeah.
like this explosion of kind of the private PT practice world has kind of put pelvic therapy on the map. Like I always thought of it as this little tiny subspecialty, and now you're seeing, more and more of it, which is so. I feel like the more of it, the more the public gets to be aware that it's a thing, right? Like, um, because I don't know that the general public is aware that that's an option.
No, no, they're not. And it's not common practice really to refer to pelvic floor therapy. Typically they get bounced around and bounced around to different physicians until they land up here and they're like, I don't know what you can do for me. I've had so many tests, so many doctors, so many medications, and their problem was their muscles. They were either too tight or too weak. And that's what PTs do, is work on muscles
Yeah.
a lot of the time.
How does the general person know maybe I should pursue something with pelvic health PT? Like, are there any indications, with back pain? It's like, if your back hurts, come on in, right? But from a pelvic health standpoint, what are things that you would recommend people to look for?
Yeah, so very kind of similar to just general physical therapy. If you're having pelvic pain, if you're having abdominal pain, those are two big indicators of a pelvic floor dysfunction. The pelvic floor can also refer to the back or the hips, the glute area. So anything sort of in that realm, that you're having kind of pain in that abdomen, pelvic floor, hip area, going to physical therapy just in general is great. And if, say, you go to a PT and you're going there for your back pain and your back pain's not clearing up, and they just can't find what exactly is going on with that, typically looking at the pelvic floor is a route that we can take. Another reason to go is if you're leaking urine. So that's a big one that I get. So people who leak with laughing, sneezing, coughing, jumping, exercising, anything like that, I see a lot of people who leak. Or if you're running to the bathroom all of the time is actually another common one. So typically, you go to the bathroom 6 to 8 times a day. I have patients come to me who are going to the bathroom 20 times a day. So a lot of the times that's a pelvic floor issue. So I work with people a lot on urgency incontinence, stress incontinence. So a lot of the times when you're leaking, it's actually pelvic floor dysfunction.
Yeah, I feel like the leaking thing has become normalized a little bit.
It has, unfortunately, it has. And that's been passed down generation to generation. Once you have kids, you just leak and you leak for the rest of your life. And that's just it, which that just has been the way of things. But now more women are talking to other women about, no, I went to this pelvic floor PT, they cleared it up, didn't have any issues. So it's great that more word of mouth is getting out there too, that there is a solution for this.
And in my experience, even though again, that's not kind of what my main practice is, but it's not just people who've had kids, right? There's a lot of
Oh,
younger crowd,
correct.
more kids, and having issues. What do you
Yep,
see with that?
definitely. So all the same things. So really, having children does not set you up to have pelvic floor issues one way or the other down the road. So after you have kids, you might just after birth have a little bit of pain, a little bit of incontinence. That should clear up as things start to heal. Things kind of come back together within that 6-week sort of window is what that typically is talked about with your OBGYNs. But I see people who have had 0 kids, who've had 5+ kids, and they come in with the same symptoms. And there's not really a big difference between people who have had kids and people who haven't. So it can be all over the board, even like young people. I have people in their 20s all the way. I've seen people in their 90s.
Yeah. Yeah. I think so often, and this was a kind of an eye-opening thing for me, is we always think of incontinence as like a weakness issue, but the muscles can be so tight that it creates a weakness as well, just like being at the top of the pull-up bar, right? Like you're not as strong up there. And so it's not always just weak. It can be too tight that's causing the problem. And I think so many people either don't think about that or ignore that. And so they go, well, I'm not weak, so therapy's not an option.
Right.
Is there like what do I want to say? Are there like things that you hear people say when it's a tightness issue versus a weakness issue? Or is there like kind of big clues?
Yes, actually there are. So with tension, typically my patients have more urgency. So they have to pee really bad or they have to pee really often, and leaking when they're trying to get to the bathroom. Also pain is another indicator of muscle tension, just like anywhere else in the body.
Quality of pain?
So
Like, is it a sharp thing? Is it an achy thing? Like, what do people experience?
it can be all sorts.
Okay.
So, a lot of the times the pelvic floor will refer to the lower abdomen. So I have a lot of people who come in and say, I have a lot of lower abdomen pressure, pain, dull ache, things like that. They can also have a sharp pain with urination. And also an indicator is pain with intercourse. That's a biggie if they have pelvic floor tension. So, and I would say the majority of my patients that I see, close to, gosh, 80-90% right now, have pelvic floor tension. Now, we also will work on strength down the road once we've gotten the pelvic floor muscles flexible, but a muscle can't act efficiently if it's tight. So if you keep doing Kegels and you're trying to strengthen a tight muscle, just like anywhere else in the body, it's not going to work very well. So we have to lengthen the muscle in order to strengthen it.
Yeah. And how much of that, oh, what do I want to say? Like, we know there's some indications that stress can cause some of that, posture type things.
Mm-hmm.
What are some of the things that you see as like causative or root cause kind of stuff?
So stress is actually one of the biggest things. So actually, mental stress causes a lot of pelvic floor tension. So if you've ever, gone through a stressful time in your life or had like a very stressful test or something come up, a lot of people will get tension in their traps or in their jaw. A lot of people also don't even realize it and they get tension in their pelvic floor. So a lot of my patients will tell me that they also have neck pain or shoulder pain or jaw pain because they're tensing everything up and they don't realize they're tensing their pelvic floor until I have them sort of tune into that in those stressful moments. And they go, oh my gosh, I had no idea that I was tensing at my pelvic floor. It was just so subconscious. So a lot of times, stressful events will cause that pelvic floor to become tight.
Yeah. We see a lot of patients with temporomandibular dysfunction, jaw issues, also
Mm-hmm.
having pelvic stuff,
Yep. Very
which you don't
related.
always like, wait, they're so far apart, but you see it a lot.
Yeah.
How about postural stuff? Are there postural patterns that I read some research years ago, but I'm curious what's out there now?
Yes, definitely. Posture definitely plays a huge role in pretty much everything physical therapy, but definitely the pelvic floor. So, a lot of people will have like an anterior tilt, so the pelvis sort of tilted forward, those tight hip flexors, and it puts the pelvis in a compromised position. So if you think of a trampoline, your pelvic floor is a lot like a trampoline. It has to move with you. It has to be strong but flexible. If you picture that trampoline and you put it off kilter somehow, then you're definitely going to have a lot of issues with your trampoline. So anything that sets that pelvic stability off in some way, you're going to have pelvic floor issues with that.
Yeah. So that is similar to kind of what we've done in the past.
Mm-hmm.
Usually it's an anterior, they're stuck in extension, which I also think is a stressed posture, right? We get hyperextended breathing, we get upper chest breathing, SCMs
Yeah.
are kicking in like crazy.
Yeah.
you're
Definitely.
postured up, right? You're ready to fight. And so, the mechanics versus the nervous system part of that is always intriguing to me. But
Hmm.
if you can get
What
people kind of in a little more tilt and a little more rib cage depression, usually it settles things.
Definitely. And one of the things that I teach all of my patients is diaphragmatic breathing because we're such chest breathers. So that helps just extend the abdomen, kind of bring the ribs down. It helps with everything. And that's another big postural thing too. Like you said, breathing is huge.
Yeah. Yeah, more and more, I think every client we need to do that with because it affects so many things, right? We could do all this manual work and get everything lined up, and then you go home and every breath is into your upper chest, and you're going to go right back into that extended posture, which um,
Yeah.
isn't doing you any favors, especially with low back, pelvic floor kind of stuff. Um,
Yeah.
I read an article years ago, like probably 10 plus years, where they were looking at pelvic floor muscle activity if you put somebody in a heeled shoe. So you put them in a high heel shoe, right? It tilts them because that's what
Yeah.
a high heel shoe does. And then it decreases activation of the pelvic floor muscles just by putting them in plantar flexion.
Yeah. Definitely.
Like little dumb things that you wouldn't even think of, right? Like,
Yeah.
um, and then you wonder if the brain just gets used to being like that's just the pattern it rolls with, because that's normal.
Yeah.
Very intriguing stuff. And I always wondered, like, chicken or egg, right? Who's causing who, right? Is it a pelvic floor dysfunction that's causing the postural issue? Is it a stress causing it's probably a
Yeah. And a
question.
lot of my patients ask me that. They say, what caused this? And a lot of times I have to say, I can't tell you. I don't know what came first exactly, but we just got to work on everything to just sort it out. And yeah, it's hard to say what kind of causes what with those issues.
I mean, even if you linked it to a birth, right, having a kid, like you got the mechanics of all the stuff that's happening, you got the ligamentous laxity, you got all that stuff, but you also just took the stress levels off the charts, right? Like your sleep's less, you got all this stuff
Yeah.
going on in your life, you're carrying this kid now, you know.
Hmm.
So there's just so many layers, and I
Yeah.
think that's what makes all rehab kind of tricky sometimes. But I think pelvic health has um, probably that many more layers of emotional stress, postural kind of assessment.
Yeah, it's definitely so much with posture, so much with stress. And that's a big thing that when I'm talking with my patients, they'll say, like, this week my symptoms were so bad, but I don't know why. I didn't do any more activity, nothing changed, like activity wise. And then I start to ask about, well, was anything stressful that came up this week? Like, was there any big like events? And they'll say, oh, yeah, like I had this and it was so stressful and made me really anxious. And I was like, well, I can guarantee that's probably why some of this is coming on because you had a big stressful event. I just had a patient who went and had a hospitalization and she got septic and was in the hospital for 3 days. During like that week and then the week after, she was fine, no urinary symptoms. And then when she was back home, kind of everything had settled, her symptoms got a lot worse that next week because that had kind of settled and the stress just came on all at once. So stress is hugely, hugely related with the pelvic floor.
Stuff. Now, you've gotten into the CrossFit game a little bit.
Yes.
Tell us what you're doing pelvic health wise with CrossFitters.
Yeah. So I started CrossFit back in March. It's been super fun. Been going to Cadre. And CrossFit definitely can pose some issues with the pelvic floor, with double unders, with heavy lifting. There's a lot of different things that we do when we do CrossFit that causes pressures in the body that withholding our breath and our form. So like we were talking about, posture super important. Form is very, very important with this. Just like we were talking about that trampoline, if it's offset for some reason and we're trying to activate that pelvic floor, it's not going to work. So we need to make sure that form is good with everything. And then with breathing, we want to make sure that we're not holding our breath with activities, because that will put a lot of pressure down on the pelvic floor. And if you're already having pelvic floor issues, that can cause a lot of problems, as well as problems with diastasis. So that's that separation of the abdominals. So if you're holding your breath, your pressure is going to go out to the abdomen or down on the pelvic floor, and that's just going to cause a lot of havoc with that.
And I don't want to put words in your mouth, but for the weightlifters in the crew, we're talking mostly like holding breath during regular ab stuff, body weight movements, activities where you're breath holding to brace your abs, not necessarily a max effort. There may be advantages to holding your breath during a max effort squat or deadlift, but if you're holding your breath every time you try to do a little abdominal curl up or a crunch or a hip flexor movement, that's a strategy issue, right? Your brain is using breath for basic movement patterns. We don't want that.
Yes.
If you are locking in your abs, breathing into a brace core to stabilize your spine for a deadlift, that's a different conversation, I would suspect. Yeah.
Totally. So if you're going for a 1 rep max, the whole point of holding your breath is to give yourself more stability, but you have to have that stability to push against in the first place. If your pelvic floor is not doing well, if it's too weak, if it's too tight, if your abdominals are too weak or too tight, then you're going to have more issues and you're not going to have that stability. So yes, we definitely use our breath, like you said, for sure, for that. We're doing that 1 rep max, getting really stable. But with just basic exercises, you're doing a lot of sit-ups, you're doing GHDs, you're doing a 10 rep, then you really should not be holding your breath, because that gives your body a sort of false stability, where you want to have that actual core stability, the stability in your back, your core, your hips. If you are just holding your breath, then you're sort of bypassing those muscles and not making them stronger for those lifts.
And I think so often I see people, they go to take their big breath to brace and they breathe into their upper chest and then throw themselves right into that anterior tilt, lengthened abdominal position, and they've lost their core. And all you hyperextension people that hyperextend for everything, myself included, you know who you are, right? It's a hard fault to break, that hyperextension. Like that's a tricky one, but that's one you see quite a bit. Especially on I feel like it's easier on a slow movement, like a power lift, but then it's a whole different beast on like double unders or an Olympic lift or something like that, where you have to dynamically maintain that posture. You really get a test of your system.
Yep, definitely. It's still the same concept. You still need that stability, but it is a dynamic movement versus that movement where you're just doing like a deadlift. Very different type of core that you need for that.
So somebody comes in and they decide they want to work with you. What's a session look like? Like from start to finish, what should somebody expect?
So pelvic floor specifically?
Pelvic floor specific, yeah.
So with pelvic floor, just like any other eval, we start with interview. So ask a lot of questions so that I can get a good idea of what's going on, kind of tell, where are we going with this, and get your history. How long has this been going on? How severe is everything? What specific activities are making things worse? Then we'll start to do an assessment. So we'll do a movement screen. Depending on what movements are causing issues, we'll kind of start there, kind of tease those out a little bit. And then with my pelvic floor patients, I'll do a one-on-one, an internal exam with the pelvic floor. So the reason that we do an internal exam with the pelvic floor is we want to know what the muscles are doing. The only way to really tell what's going on with the pelvic floor muscles is to feel them, to test them just like we would any other muscle. So we'll do a flexibility test with them, and we'll do a strength and coordination test. So that gives me a really great picture of how strong you are, what you're having issues with, the coordination with the pelvic floor, how flexible things are, if you're having pain with that. So we'll do that as well with the exam. We'll usually check for a diastasis with that too. And then after we check everything out, we'll create a plan. I'll give you some exercises, see where things are going from there. Like I said, I'll typically teach you diaphragmatic breathing because that's just a great thing for everybody to know how to do. And then we'll just go from there. So have follow-up sessions as needed.
What's a plan of care typically look like?
Oh, that's very variable.
Impossible. Yeah, but
It's it's that's very hard to say. Typically, if I have someone who, no tension, just weakness, I'll typically give them a lot of strength work and we'll progress pretty quickly through that.
and when you say strength work, we're not just talking Kegels, right? Like there's more to this.
Much, much more to this. So Kegels are sort of the basic. We can do weighted Kegels. We'll do Kegels with various exercises. But another big piece of it, like we've been pointing out, is posture. So what is going on with your posture and the different exercises or different activities that are causing you these issues? So we'll go through that as well. So we'll have a lot of different things that you're working on strength-wise, sort of on your own. That the strength folks that I have typically will progress kind of a little bit quicker. The people who are having more of an issue with flexibility first will start by doing actual soft tissue mobilization to the pelvic floor specifically. And after a session, I'll start to teach you how you can do it on your own at home, give you homework for that. Everybody is so different with this because everyone has different triggers on what sets off their pelvic floor. So I could have people for just a couple weeks and things are going fine. They've learned the techniques, they're doing great. And I have people that I've had up to about a year. Now, the people that I see for about a year, I'm not seeing them every week for a year. It's every week, then we move to every other week, then once a month, then maybe just some check-ins. So the pelvic floor sometimes can take a little bit longer than another muscle because we're working with a lot of different systems, the urinary system, musculoskeletal, nervous system, all of that. So we have a lot of different things that we're working on. The other reason that it can take a lot longer is, unfortunately, people who have pelvic floor issues don't come to see a physical therapist until it's been years and years and years of this issue. So we have a lot of years to undo. Now, it doesn't take years to get this solved, but it can take months. So it takes a while to sort of unwork all of this. So that's why I can't really give you a specific time frame because everyone is so different.
No, that was perfect. And obviously, I know that's an impossible question, but I feel like people want to know, right? Like, what are we getting into?
Yeah.
And so often people just want a quick fix.
Yes.
And sometimes there are quick fix options, but
Mhm.
sometimes you're undoing layers, like you're talking about, where you're trying to change strategies and positioning and stuff. So
Yeah. Yeah.
what is something that people maybe wouldn't think about when it comes to pelvic health? Like, other than things we've talked about, is there anything else that's like, I wish people knew this?
There's a couple things. So first one, I would say, which I think a lot of people might know, but might not pursue, is pelvic floor therapy. You can have it while you're pregnant. I work with a lot of pregnant clients that third trimester to help them prepare for birth. So a lot of the times that last trimester of pregnancy, as baby is growing, that puts a lot more stress on your pelvic floor, especially if you're exercising, you're active. It's having to do a lot more work. And that can a lot of the times make the pelvic floor tight. So when you're giving birth, you don't want the pelvic floor to be tight. You want it to be nice and flexible. So we work on pelvic floor muscle flexibility. We work on perineal massage to help prepare the body for birth, which can be super beneficial. I wish that all pregnant people saw a pelvic floor therapist at least postpartum so that we can clear up any issues right away. I've had a lot of people come to me in their 40s, 50s, 60s who said, I've had issues ever since I gave birth to my child. And
Hit
I
number
wish that
three.
pelvic
Yeah.
floor was just the standard of care afterwards, just at least one visit to just make sure everything is okay, give someone some pointers and tips to, not leak for the rest of their life or not have pain. So that's definitely one big thing that I would love for people to know. One other thing is that men have pelvic floors too. So it's not just women that go through this. Men have pelvic floor pain. It doesn't really come out in an incontinence issue like it might for women, but I do have clients who are men and they have pelvic floor pain, and we can do a lot with that to work on decreasing that because they also suffer. So, yeah.
Yeah. Yeah, that's a whole nother can of worms, I'm sure. But in general, I feel like we're pretty lucky on that front. We don't have to do the whole baby thing. We don't have to carry.
Right, right. And it's significantly a smaller
Yeah.
percentage of men that have pelvic floor issues, but I feel like men are even bounced around a lot more than women are. And a lot of the times they have to go to a urogynecologist's office because they don't have the care that they need. So men,
Generally speaking, men don't seek out care, period. So I'm sure
that's also true.
it's even worse in this situation.
That's also true.
Yeah.
Yeah.
That's been my we're bigger babies for sure. Like we don't tolerate pain like women, and we tend to be more stubborn, I think, in general. But nature of the beast, I guess.
Yep.
Generalization. Very cool, very cool. All right. I mean, is there anything else you want? I mean, I think that was awesome. Hopefully people get to meet you. I'm excited to see things happening in Hudson.
Yeah.
From our athletic population to some of the, I mean, I literally had a lady this week in New Aval who said exactly what you said. She's got her youngest is 10, and she's like, I've had back pain since he was born. So there's obviously those components to all that stuff. So it's going to be a great addition to the team having you around, and I think it'll be great to be able to refer clients that way. And I'm excited. But any last things you want to wrap up with?
I guess just to say, I don't only see pelvic floor patients. So even if you're not having a pelvic floor issue, you can come see me at Cadre. So I do see the gambit of everything. But
I'm glad you
really,
clarified that.
yeah. Yep. So I see everybody. But yeah, I'm really excited. I love Cadre. It's a great gym. I'm excited to be with Fit for Function. So yeah, come see me.
All right. And where can people see more about you? You're very active on social media. Where can people learn more about your stuff?
Yeah, so I'm at Pelvic Floor Fitness on Instagram and TikTok.
Perfect. And of course, you can schedule an appointment through us at fitforfunction.com or at the jnapp.fit.jnapp.com. We'll get you set up there, or talk to Heather and she'll get you scheduled. But otherwise, Caitlin, great to have you on the team. Hopefully more people are utilizing you here in the next few months, and I'm excited to see where things go.
Yeah, great. Thank you so much. I'm really excited.
Awesome. Thanks. Thanks for watching and supporting the channel. We hope you enjoyed this week's episode. Let us know in the comments below what you liked, what you disliked, what you'd like to hear more of, and any questions we can help answer. We appreciate your support, and we look forward to seeing you on the next one.